Good to see you again.
Hello, Adam.
Thanks for coming in, Roberto.
There we go.
Roberto and I work closely together. Again, I'm inside of Primal Athletics, and he is a strength trainer at Primal Athletics. And I'm actually just going to let him tell us a little bit about himself. Why not? So, Roberto.
No worries. So I am a personal trainer from Primal Athletics, and outside of Primal Athletics, I do hand balancing, which involves me doing tricks upside down and doing a lot of handstands. So yeah,
I would imagine that's pretty physically demanding.
Yes, my shoulders are chronically tired and my hips are chronically stretched out.
Oh, nice. Yeah, okay, so kind of full body.
Yeah.
Then how? Like I don't know. I'm afraid to be upside down personally. I think that most people are afraid to be upside down, but just because I'm curious and I do want to learn how to do handstands from you someday, like what's like the number one tip that you can give people who are trying to handstand for the first time? Like how do you approach that?
So when I deal with absolute beginners, I actually teach them how to fail first, and how to fail safely. So my goal would be teaching them how to, for the most part, get on the wall, and then how to fall off the wall. That relates to actually being off the wall in the future. All right, and doing it in a manner that they're always safe. So majority, I would say, push the ground and look at your hands, and you're very less likely to actually fall on your face.
Okay, well that's there's a life lesson in that probably. All right, you got to fail before you can succeed, right? I think we've all been there.
Fail safely.
You
so
don't.
You can try again.
Not catastrophically.
Yeah,
that's good. Anything else in addition to obviously the shoulders and the hips, which are both probably very, very tight or very hypertonic? What about like spine structures or middle, upper, lower backs? Like
I would say mostly either lower back or upper back or neck. Yeah.
Okay, so there's a combination factor, right? Anytime we're dealing with a shoulder complaint, it's also good form to look above and below. Okay, so I can imagine that being very physically demanding. It's going to be tiring on your body. So what we're going to do today is I'm going to physically examine you, okay, and then from there figure out how I can help you best, whatever I think you'd respond best to. Sound good?
Sounds good to me.
Awesome, perfect. All right, bro, so I'm just going to start by getting you to bring your chin down to your chest for me, okay? I want you to let me know if this kind of provokes any discomfort or stiffness with you, or if you feel anything at all. Anything there?
Nope.
It actually feels like you're giving me some resistance, so maybe that's just some thick neck muscles that you built up here, some upper traps, back the other way. Anything there? Yes, no? No. Okay, good. Back forward. Get you to rotate, check your blind spot, rotate your head this way for me. Good, as far as you can. So Roberto's got very stiff end ranges, and what that means is, I'll get you to rotate your head this way, is when he does turn as far as he can one direction, I'm having a lot of trouble actually getting him to further move a little bit beyond that. And usually with most patients, you'll find that there's an extra, like, I don't know, centimeter or two of give in these directions. But with him, he's got some ropey upper trap muscles, so that's probably a consequence of his handstanding, but that's a good thing. You should keep it up. I'll get you to drop your ear down to your shoulder, like try to tilt your head. Good. Same deal on this side. And again, more resistance, and we'll get you on this side as well. Good. Oop, got a little release there, that's fine. Good. Okay, and forward. I'll get you to bring, we're going to do the shoulders now, so I want you to start by giving me a thumbs up. Good, big thumbs up, just like you should with the video. And you're going to keep that there, keep it there, don't let me move it. Good, give me a thumbs down, and keep it there. Awesome, okay. Want you to, you're good, you can come back, bend, keep it there, don't let me move you, okay? Fight, 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 fight. Good, and again, back this way. Fight, 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 fight. Awesome. Put this hand behind your back, and I want you to try to lift it up off your back for me. Any discomfort with that?
It's hard to do.
It's hard to do because you got to get these giant shoulders. Okay, good. And you can relax on that. And same on this side. Give me a thumbs up.
No.
Keep it there. Good. Give me a thumbs down. Keep it there. Awesome. Bring it back. Bend at the elbow. Keep here. Good. Keep there. Good. And last one, behind back, and lift off. How's that? That's
still
okay,
tough.
You look like you're struggling there. Now, is that tough because you're stiff, or tough? You can relax.
I think I'm just stiff.
You're stiff?
Yeah.
All right. Okay, so continuing the trend of having some very strong patients. Roberto too has a very, I can even feel it through the t-shirt. Very defined back, so to speak. So these big muscles that we have that run down just the outside of our spine, they're referred to as our paraspinal muscle groups or our spinal erectors because they help us to stand up straight. And they feel like absolute guy wires or cables just running up and down him. In fact, there was even a little release there. So I think that I think we're going to be able to help Roberto out today. We'll probably be doing some instrument-assisted soft tissue therapy later as well. So. Feel a little tighter on your left actually today than you do your right. Okay. I'll get you to flip onto your back for me. Just be careful because the mic's next to you, but you're good otherwise. Thank you. And you just lay down. Okay, so good. Oh my God, your shoulders, dude. Alright, I'm just going to bring this leg straight up, and I'm expecting this to come all the way up considering how, oh my goodness. So most people can't even get to 90 degrees, but here, we definitely got a 90-degree angle on him. That's good. And we're going to do the same with the other side now, okay? Awesome, yeah, he's able to fully engage still while he's doing that as well. So Roberto, definitely a prime example for mobility, despite still being quite tight himself. I don't know how he can be both, but there we are. So, in feeling Roberto's neck, we are continuing to feel some pretty big ropey paraspinals up into the C-spine as well. Again, our paraspinal muscle group exists all throughout our spine, so it's no surprise that we feel them up here too. That's you relaxed, eh? Genuinely. Whew, man. If you ever want to get strong, guys, consider becoming a hand balancing artist or a hand balancer. Excuse me, that's what it's called?
Yeah.
Okay, 'cause damn. Alright, so a little bit of... You just let me know if I'm using too much pressure here, okay? So I think we're ready to adjust that right side, okay? So let's just correct that mic. Okay, so what I need from you is to try to relax that neck as best you can for me, okay? And okay. Now what I need from me is to not talk as much when I'm doing this. Was a big one. Yeah.
Oh yeah.
Get your face down. So it's going to be hard to get through the spinal erectors on Roberto here, but we're going to do our darndest. just that. Okay, big breath in and big breath out. In and out. Well, we got those. That's the good news. Now if I do that, like this. Big breath in and out. It's harder for you. Yeah. Okay. Bend this leg and straighten this bottom one for me. Good. And then I'll just give you a hug because I like you so much. And arms just like so, okay? So scoot your hips a little closer to me, please. Thank you. All right. Now, let's see if the low back will cooperate for us today. So. Breath in and out. Got that one? That's okay. One more try. In and out. Stubborn. Okay, now we're going to do the same thing on this side, okay? So, just like so. Hips a little closer to me. Thank you. Okay, relax this shoulder. Good. Okay. Give me a breath in and a breath out. If you want a tight back, be a handstand balancer. You okay?
That's ticklish.
Gucci Gucci. Gucci Goo. Alright.
Oh, Jesus, I never knew.
Yeah. Well, just try to relax as best you can. I'll use a little bit more pressure. Some people are ticklish with this technique, but usually not. Roberto's in the minority in this case, so.
I never knew it was ticklish in the back.
Yeah, it's not really a place people think when they think ticklish. They think, armpits, ribs, but anyway, so just so you know, we are getting a little bit of redness back here, but that's totally normal with this technique. Okay, it brings in more blood flow. It breaks down some fascial adhesions, which is like a thing that covers all of our muscles. So just don't be surprised if you look in the mirror and it looks like you got mauled by a bear. Okay. I'm especially going to focus on this low back because it was very difficult to work my way in there. So I'm going to bring this down just a smidgen.
I don't know why I find that so ticklish.
You still find it ticklish, huh?
Oh.
Let's distract you. What's your favorite memory so far of working at Primal? Or what's your favorite memory of being a hand balancer or a favorite client or something?
Oh, well, My favorites are, I would say, the reactions I get from people. Yeah.
Like when they handstand for the first time?
Yeah, or like when I go out like into like the park and try to get a nice shot, and people are just like.
Oh, like they're just walking by, like, who's this guy? Like in the middle of the park, doing handstands, filming himself.
I love the kids. The kids' reactions are the best because they're just so like innocent and genuine. You know, they're just like, "Oh my god, no!"
That's so cool.
And then like 2 seconds later, you see them doing cartwheels. You're like, "Yeah, that was me." I get a bit of a joy making sure their parents have a harder time taking care of the kids.
You were the cartwheel kid. Eh?
Yeah, I definitely was the cartwheel kid.
That's still ticklish?
Bad, yeah.
It's too much pressure.
It's fine. Pressure's fine. I just
Suck
don't
it
know
up.
why. I'm like, well, I'm finding it ticklish. I don't know why.
Better ticklish than painful, I see.
Maybe it just makes me like tense up.
That's okay. It makes my job easier, actually. So we definitely have that redness or petechia, especially happening down here at the bottom. Anybody watching can see that from here. But again, totally normal, expected. Just kind of indicates where you might be tightest. Got some other... Sorry, getting a little bit on your ear there. Going to get you to slide just like an inch towards me over here, okay? This way to the left, good. All right, and I'm going to kind of grab you like this, and you just let me move you as best you can, okay? Good, and you can see just fine. So this, I know you were commenting that you got some stiff shoulders, and also in that one test, you trying to lift your hand off your back, which is called our lift-off test. That engages our subscapularis muscle. So this is me really trying to get underneath your scap where that subscap is. Try to loosen him up, hopefully make that a little bit of an easier motion for you, okay? Got a lot of muscle to work through back here. Okay. We're going to do the other side too.
Technically, these are the glutes of the upper body, so.
The glutes of the upper body, I love it. Yeah. I'll get you to slide over to the right. I guess you're actually right, yeah, because if our shoulders are our upper body's hips, and these are the posterior elements of them, then yeah. Okay, we're working your upper body glutes today. Relax that shoulder, relax, good. Never took the time to think of them like that. I just think of them as the shoulder complex.
It's because I'm upside down.
Yeah. So these are the lower ball and sockets, eh? Got it. Okay. I'm gonna have to turn that one down on the microphone because we're both laughing like full volume when it's right there. Sorry, anybody watching. My bad. Ooh. So I can tell that you're right-handed though, because it's a lot harder to get under this one. Unless you're left-handed. You left-handed?
I'm right-handed.
Okay, yeah. I was gonna say I'm pretty sure you're right-handed. Ooh.
Yeah, I felt that one.
Shirt back on, face down. Now, because you did have a lot of tightness in this kind of upper shoulder trapezius area, what we're going to do here is something called MRT, or myofascial release technique. Okay, the first one's going to be for a levator scap. So what we're going to do is I'm going to get you to look up and to the right for me. Okay, I'm going to take my very pointy elbow. I'm going to jam it right there. Okay, and now I want you to look down and to the left slowly for me. Okay, go ahead. Down and to the left slowly. Keep going, keep going, keep going, keep going. Good, just like that. Is that okay? Okay, and we're going to just repeat that motion. So again, up and to the right, and slowly, slowly, slowly down to the left for me. Now, if that is too much pressure, let me know. But trying to do a job. Up and to the right, down to the left. Good. To right. Last one, then we're going to switch to a different motion. Okay, go ahead. Awesome. Yeah, very good. So now we're going to do a tilt. Okay, so you're going to start with your head tilted to the right. I'm going to contact this for the upper trap. I want you to tilt your head to the left. Go ahead, best you can. A little difficult, eh?
Yeah. Good thing.
Yeah, that's all fine. That's fine. And to the right again. And to the left. Good. And to the right. And to the left. Awesome. Okay, one more. Last one. To the right. And to the left. Good stuff.
You hear like cracking.
You can hear kind of that. Okay, good. All right, now we're going to do this on the left side. So same thing, so we're going to start up and to the left. Point the elbow and down and to the right slowly. Good, up and to left. And down and to right. Good, up and to left. And down and to right. Last one, up and to left. Down and to right. Okay, tilt left. And tilt right. Good, tilt left. And tilt right. Good, tilt left. Two more, buddy, two more. Almost done. Tilt right. Last one.
It's just really tough to do it.
Pardon?
It's tough to
Oh
do.
no, I know. You tell Roberto's shaking. That's because this hurts, but it's for it in the it's worth it in the long run. Go ahead. Last one. Good. Awesome. Okay. Is this ticklish too? Oh my goodness. I can tell because you're tensing up more with it on. I'll try to make it quick, buddy. So in a patient like Roberto, where he's ticklish, as soon as I put this on him, everything fires here. He tries to guard, so it's probably not going to do much good for his low back. His upper back, he was more relaxed, and the shoulders, he was more relaxed, so that's the good news up there. We'll also do a little bit of glute work too, because why not? And he doesn't appear to be tensing up down here, so Roberto does not have a ticklish ass. buddy. You can get up. How are you feeling?
Good.
Oh, feel good?
Yeah.
All right. Well, thanks for coming in.
Wow. I'm curious to see, because like I do try to take care of my shoulders a lot, right? Like you do a lot. There's only so much you can do by yourself, right? So having someone else to deep dive into it helps me.
Yeah,
I do a lot of foam rolling, a lot of like tennis balls and stuff like that, because like I'm on them a lot, and you need to make sure I can stay on them. So yeah, I'm just see how much the difference.
It can really help to. This is not me doing a plug, but it can really help to see somebody for these kinds of things, whether that's a chiropractor like myself, or a massage therapist, or a physiotherapist, maybe a physiatrist too, which is an MD that works on these kinds of complaints if they have availability. You're not going to get that here in Canada, but like having somebody reach those areas that just there's no way to work your subscap that way or serratus anterior that way other than having that individual help you out. But I'm glad you seem to have gotten some use out of it.
Yeah, I'm gonna be training shortly after this, so I can give you a personal review.
We'll see the video today. I guess say bye. That's important.
Have to conclude the video.
Yeah. Take care.